Very healthy, actually.
Not very healthy.
Very healthy, I think, yeah.
I think I'm okay. I could probably be a little bit better.
It might not be what you want to hear going into the festive season, but Aussies are drinking too much, not moving enough, and our mental health is worse than ever.
I feel like everyone I know has like some sort of mental health issue.
It's definitely going downhill, and I feel like it's hard for people to access resources these days.
The Bureau of Statistics has dropped its National Health Survey, and things aren't great. While there has been an uptick in people meeting physical activity guidelines, there are still 4 times as many who don't, with almost 3 million of us deemed sedentary.
It's really concerning that Australians just aren't getting enough physical activity and exercise. It's absolutely critical for their health. We look at things like the 10,000 steps or perhaps a half an hour of physical activity every day, but that's the absolute minimum you should get, and if it's at all possible, try to aim for much more than that.
There's also been a significant drop in the number of children eating enough fruit, and only 1 in 20 are getting the recommended daily serve of veggies.
Really hard to believe. I mean, we tried to force our kids to have vegetables every night in some form, even if you had to hide them.
We know that when kids are going about their daily lives, they're exposed to enormous amounts of advertising for unhealthy, nutritionally hopeless junk food. It's a national scandal.
1 in 4 Aussie kids were found to be overweight or obese, and 2/3 of adults.
The way our society is set up, it can actually be hard to exercise, and it can be easy to get food that's really not good for you. It's going to take a huge national effort to turn these things around, and successive governments have really struggled to do it.
And when it comes to drinking, more than a quarter of us are having more alcohol than we should be, which is a max of 10 standard drinks a week.
Aussies are known for liking their grog. I'm definitely one of them.
But in a pinch of good news, the number of Aussies smoking daily has dropped, and 3 in 5 adults have never smoked a cigarette. So as we start thinking New Year's resolutions, should getting healthy be at the top?
And Dr. Sandro Demaio is here to tell us if it should be. Dr. Sandro, what worries you most from this survey?
Well, I think the survey once again shows some worrying trajectories that Australia's been on for a while now. First of all, steadily increasing rates of chronic disease. Most Australians now are living with a chronic condition, many with multiple conditions. That's putting huge strain on our health system, but also, having an impact on people's lives and livelihoods. We're seeing an increase in mental health and psychological distress, but also really concerningly, chronic disease happening earlier and earlier and affecting our kids.
We hear these messages often, but our obesity rates aren't getting any better. Is this just something that's going to get worse generation to generation?
Well, look, what we do know from the science is that the youngest generation of Australians are likely to be the first in history to live a shorter life expectancy than their parents due to the increase in chronic disease, including the increase in obesity. But, this has come out of nowhere over about 30 years. We can reverse that trend, but we need to put really critical things in place. Other countries are doing it and seeing results. Australia can step up and put health front and centre, and we would start to see those trends reverse.
The federal government is working on a plan to reduce the number of kids living with obesity. What do they actually need to do to change that?
Well, the cost of good food is clearly playing out. We're seeing, families in really tough times having to make decisions and often turning to less healthy foods simply because they need to have enough food to put on the table. So cost of food is a big one, and I know that that's on the government's agenda. But then other things like digital advertising. Kids are being constantly bombarded with messages to eat the wrong types of food, to eat more food. Protecting kids from digital advertising, from advertising particularly early in life, for foods that are associated with chronic disease would go a long way. And then another option could be to look at the pricing, not things that are going to increase the price of food at the checkout, but are going to force industry to make food better quality, increase the quality and make better food more affordable.
You touched on this. The cost of living is obviously having an impact on our food choices. Fruit and veggies, really expensive. Is it true that healthy foods are more expensive at the moment than less healthy options?
Yeah, absolutely they are, and you can see it show up in the data once again this week. there is not a parent, there is not a family in Australia who doesn't want to put the best possible food on the family dining table, but it's becoming incredibly expensive and hard to access. We saw prices increase after the bushfires, compounded by the pandemic, and now the cost of living crisis. It is really squeezing family budgets. And then, of course, the psychological stress associated with that. It's no surprise that mental illness is increasing. There is a lot of stress on households at the moment. Australians are facing very tough times.
Thanks so much for your time, Dr. Sandro.
Thank you and Merry Christmas.
So I think governments could offer training to both parents and children alike in the hiding of vegetables inside the other meal.
Yeah, that would be a good thing, because I was thinking to myself, you know what, as a kid I actually really like my vegetables, and then I was thinking, what did I eat? Oh, I ate cauliflower cheese.
Yeah.
If an ounce of the goodness of the cauliflower got through that cheese, I would be highly surprised.
Don't you remember, like, hiding the carrot or the peas or whatever inside the shepherd's pie?
Yes.
With the sauce.
The pasta sauce.
So
or the bolognese.
Yeah, exactly.
Yes.
So that the vegetable item was not really recognisable.
Oh, no.
It was just texture
Yeah.
on the way
Put
through.
more spinach and chicken nuggets, and I would have eaten 100 chicken nuggets.
There you go.